Welcome to KIMEcast, where we break through and cut the BS in sports medicine, rehabilitation, and sports performance, and talk about how things really work. Welcome to KIMEcast. Tony Russ Dunning.
Howdy.
So let's take a look at a conversation around sports medicine, what it is, who we are, like where we came to be here, and I think some of the challenges that are out there in our space of physical therapy. And are you doing sports medicine? Are you doing orthopedics? What exactly is it you're doing? This came about with some conversations, people reaching out to us, questions on social and such, as well as applicants who have applied to join the team, which is fantastic, and where their interpretation of what their experience has been and what they've been able to do. So this is something that was really passionate for me from a very early on standpoint in our field. So the physical therapist, you typically have like a space that have a whatever, they'd be in a strip mall or they'd be in a building or whatever, and it would always say, what we do. So it'd say orthopedics, and it would say sports medicine and blah, blah, blah. And I would always laugh. I'm like, man, there's nothing sports about that place, And so I think sports medicine is a few things. First, one thing is a facility. Is your facility capable of doing some sports-oriented movements? Can you run, change direction? Can you throw a medicine ball off a wall? I think these are critical aspects of what I would consider to be a sports facility. If it does, how much is the weights available? It's a funny thing always in PT is do they have more than 10 pounds in the building? That's always a good question to ask. So those things are necessary to load the body to the right degree so you could do a return to sport type of scenario.
Yeah, I think there's a distinction, in the manual therapy world. You can also call it massage. I think there's some people who do, sports massage or sports manual therapy, and maybe that can exist in a room with a table. But really in the physical therapy realm, if you're not coaching to movement, I really wouldn't call it physical therapy. So physical therapy should be physical. Physical is not the practitioner doing anything. It's the patient, the user, the player, the athlete should be moving through the experience, learn how to move better, learn how to load their bodies. And if there's not an environment to do some groundwork, that's really easy to see. Is there an open space to, whether you're doing a rolling pattern or a crawling pattern or a Turkish getup, you should be doing something on the floor to interact with the ground. Could it be as simple as dynamic gait, running and jumping, that kind of thing. And then also load, either sleds and trap bars and kettlebells and dumbbells and some kind of rack system, and hopefully a wall to interact with. And if you see those tools for load and you see the space for movement, now we have an environment to actually engage in sports physical therapy.
100%. I like that quite a bit. That's a good way to look at it. I think that's really good. I also say that I've seen people that be able to operate very, very well in an 8x8 box, so you can get this done in a small space. It takes a tremendous amount of creativity and innovation by the therapist or the coach. So it's possible, but it certainly doesn't scream sports, and that's the case. One thing we look at our facilities as well, all of our facilities look for a place where we could actually go outside and run a longer distance, do some sort of a build-up run at 60, 70, 80 yards, as well as a space where we could throw a baseball or throw some other ball or overhead implement, play volleyball, do something that might be indicated by one of our clients. It's really nice to have turf and actually be able to put cleats on. That's a real bonus. It's very, very hard to find that in an indoor facility. And, I don't know that it's absolutely critical to the process, but it certainly is a huge, huge plus. Because it's a space I think that's under-trained as far as rehabbing an athlete that has a lower extremity problem back to putting cleats on is quite a bit different as far as torque on the lower extremity. So,
well, I think the continuum here is that the person that can speak to the 17-year-old baseball athlete can also speak to the 26-year-old CrossFit athlete, that can speak to the 38-year-old get fit after 3 babies person, can speak to the 50-year-old that's engaging with pickleball and cycling and maybe fell off their mountain bike, and then also engages with a 70-year-old that's really an avid hiker. So it speaks on the continuum of movement medicine. When you can speak at each one of those levels, it's actually the same human condition. It's the same understanding of how to program and the science of adaptation. When you speak any one of those languages at an elite level, you actually really do speak them all. There just might be some niche within a particular sport, whether you're an overhead rotational athlete or whether you're more of a dynamic multi-directional athlete or you're living in the water. So there's some nuances for sure in the specific sport realm. But when you're speaking of movement medicine, it's speaking to the whole continuum.
I think that's really the differentiating factor. So if we talked about facility there for a moment because it's what you see on the door, but at the end of the day, it's really the decision-making process that goes on in there that's really makes it sports medicine or not. And for me, and you're dealing with an athletic person who's very motivated to return to a sport or to play a sport at a high level, the level of questions and the level of demand of excellence that they have is so high that it forces the clinician to reciprocate that, to be in the same conversation and be able to say, yes, this is the answer to that question, boom, 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 to your point, Russ, or yes, this is how we're going to progress you, da, 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 or I want to make sure you can do this before I allow you to do this. All of those types of things are really, really, really critical steps, and they make you think. So what defines a sports medicine PT, I would say, would be somebody who's really actively thinking and going through a process to differentiate what the person can do now to what the person's wanting to do in the future, and then bridging that gap and filling that in. And that takes a tremendous amount of creativity. If you're, well, that's not really the right word, but innovation, I guess, would be the better word, where you have to innovate movements and exercises to tailor it to what the guy needs compared to what he's trying to accomplish. I think that we get negative on creativity, so I don't like using that word. People think, oh, I'm not creative, so I can't do this. That's not true. What you need to be is a problem-solving person and put together a process. But yeah, I think that mentally the focus point is very different. If you're dealing with a physical therapist, or if you find yourself as a PT and you're giving fairly routine answers, fairly routine exercise programs, predetermined, if you will, then you're probably not operating at a level that a higher level sports medicine, certainly not a high performance person, would be operating at. Now, operating protocols and stuff is very, very important, and that's great, and having a routine is great, but if that's all you're doing and you're not actively really critically thinking through steps and sequencing and load variations and considering the person's life as part of the equation, then you're missing the boat.
Yeah, especially these days with an infinite amount of information at people's fingertips on their phone, on their laptop. The person, the patient, the client is going to care much more about their body than any practitioner. And that means they're going to seek out resources, whether it's through forums or AI. They're going to find parts of their journey, answers to their journey, answers to their deep questions. And if you can't help them navigate that journey with a first principle mindset, understanding benchmarks and how tissue adapts and the load that they need on their body to accomplish their goals, if you can't speak at a custom level to that person, they will unfortunately see that you're just full of recipes that are free online. And if all you know is a protocol and a recipe that's easily accessible by any person, you stop being of value. So you have to think. You have to be the detective right next to that person and help them discover their customized solution based off their goals. If you're not ready for that, well, then the industry is going to pass you up.
Oh yeah, I remember I had this patient that was back probably like maybe 2010. I'm going to guess somewhere in that ballpark. And this guy there's a young guy, probably like 25 years old, had some shoulder stuff going on. It's kind of a nasty shoulder situation, a bit of a labral involvement, had some rotator cuff involvement, had a problematic surgery prior to that, and then a follow-up surgery from a different doc to do some cleanup here. But either way, the docs are pretty traditional and had been doing it for a while. So the young man brought in the protocol, which is classic, pretty consistent. I think that's great. And he brings it in a manila folder, and then I open it up, and it's the NEAR protocol, which was published in 1979, which I found to be amazing. So I'm like, yes, I studied this back when I was in school. And I was born in 1979, so it's as old as I am at the moment, actually. So he was serious. The doctor gave, this is the protocol I want you to follow. 1979, we're in 2010. I'm like, so many things are wrong with that concept. Now, one thing that hasn't changed since 1979 is tissue healing. So we can all be on the same page that, hey, tissue healing wise, it is what it is. There's very few ways to really speed it up unless you do things illegally and use different types of drugs. There's certainly ways to enhance it as far as what you eat, sleeping, your hormone balance. I mean, there's many, many variables that will be there that we really strongly believe in and facilitate. But at the end of the day, the timelines of tissue healing has not changed all that much in the last 50 years. However, the surgical protocol of how to do the surgery is dramatically changed from what NEAR did when he first came out and did the rotator cuff work. It was amazing what they were doing down there. Obviously doing open procedures and moving to mini open procedures and then sewing up the tissue, and they were doing like a single row to a double row technique. And then they went to all this mattress things in the early 2000s and multiple fixation points. They can get better healing of the tissue, better take of the tissue to the bone. So that was pretty awesome. But if you had neglected all of that development, and we're running a protocol of exercises based on what happened in 1979, like your person should be better twice as fast just because they don't have the collateral damage and some of the other variables that are going to slow down that progressive process.
Mm-hmm. And so much of it was based off of fear. The fear is, we're gonna brace this, we're gonna lock in that, we're gonna immobilize this. And the more everyone learned, the more they realized that if you express the tendon, express the muscle, and even express the ligament with an appropriate load early on, you get great growth in the area that you want to grow.
This is what we've learned tremendously recently. Yeah.
I think every ortho is going to say, hey, it's just as much my technique as your own healing potential and doing the work and the person that guides you. And the reason why that's so critical is if you don't do anything, if you don't engage in your own activity and your own healing, then the tissue is not going to express and the repair won't be good. So if you take a phenomenal repair and don't do anything with the tissue with an appropriate load at the right time, it's bad. It's a bad repair. It'll fail.
Yes.
So you can't have this phenomenal technique and a person that does the wrong thing, which is usually, it is the extreme. It's doing way too much too soon and it's doing nothing at all for too long.
Yes.
When you're in either of the extremes, you don't get a great outcome.
Yeah, no, I think going back to that, that's exactly right. So what I was suggesting, just to be clear, is that we know how long it takes for tendon to heal or bone to heal on these things, but there is issues on whether or not they heal together effectively after a surgery. And we do know that the way we load them, the way we move them have tremendous impacts on that. That's more recently discovered in the past 20 years for sure, much more so even in the last few with the additions of other tools like stem cells, PRP, et cetera. But this idea of load is really interesting. And this probably is what defines your more sports medicine therapist to more of versus your traditional orthopedic therapist is this knowledge of tissue adaptations, knowledge of cellular healing, and then how you load this person to maximize it. So most of the scientists will say load immediately. We've seen this even on the Achilles tendon is load immediately because the science suggests that the faster you load it, the better the actual cell division becomes, the better the cell actually changes and starts to morph into the tendinous tissue or the muscular tissue that it's being in place with. Because cells come out in the stem cell type fashion, then as you put load on them, it teaches them what to become.
It expresses it.
So if you don't load them, then they come out and they just form into a scar.
Yeah.
And they really are dysfunctional. They don't really know what to do.
Yeah.
So they're not really strong. They're not really elastic. They're none of the things you want them to be if you're working with the tendon or muscle tissue at least. So
it is the Goldilocks paradox. You don't want it too cold. You don't want it too hot. You want that little sweet spot. And I think as PTs, we're the sports PT is trying to aim in the middle throughout the rehab experience. Not too little, which gives you atrophy, which gives you scar, excessive scar, which leads to adhesion and tightness, and really ultimately you wishing you never did the surgery. So you don't want too little. You don't want too much. Too much might compromise the repair. Too much also regularly inflames the area. The person has to deal with way too much pain than the intent and how the surgery should go. So we do have quite a few feedback cues, whether it's chronically inflamed or it's poor activation, poor posture, poor positioning. They're not upholding the benchmarks of what we see regularly, whether it's it's an ACL, rotator cuff repair, Achilles repair. We should see certain benchmarks be hit according to best practice. So you don't want to be too little. You don't want to be too much. And I oftentimes say that to people. Hey, I want to kind of keep you in this middle, and that's what good is. And in the middle is very minimal inflammation, or you deal with it very quickly, meaning like maybe just a day of soreness after certain exercises, and then you get rid of it really, really quick. And it also leads to a slow progression where each week their function should enhance a little bit more.
It should grow. Yeah. If it's not growing, then they're probably either too much or too little, one or the other. I think as we think about that and look at more ways of differentiation, it's understanding the person in front of you. So we use a pyramid type structure of, build a foundation first, which we include like lifestyle in the base of that foundation. So, how healthy is the person eating? How well are they sleeping? How well are they managing stress? And do they do other general movement? Are they doing some sort of cardiovascular fitness or at least walking or exercise, et cetera? And if that box isn't filled, then we have a higher level of kind of disease state or comorbidities. So that's going to affect healing time frames quite a bit, and therefore that's going to affect your ability to push this person. Can you push them forward, or do you have to kind of pull back, be patient, and allow the tissue more time to heal? Maybe they have diabetes, some other factors that could be included in that as well. So that's a big deal. Now, age is part of the spectrum. So we know that someone younger tends to heal faster than someone older, but that spectrum could be skewed slightly based on their overall health. So someone who's a little bit older might heal really, really well based on their genetic code, plus a variety of other things. They sleep well, they eat well, they are active, they've been active their whole life. These variables can improve that. So you might be able to push that person slightly faster than you would someone of the same age that wasn't as active or didn't have some of those other benefits.
And going to the age thing, I think there's more evidence that's kind of popping out. We know sarcopenia upticks probably in your mid-50s for the majority of people. I saw a great study that looked at aging and what are the biological cues of aging, and they find that between around your late 50s, early 60s, you actually get older quicker in that moment. It's an inflection point in how we age. So to be very clear, I think aging, we could think of it as, your hormonal profile is a little more sluggish the older we get, but I think there is more of that inflection point, probably closer to 60. So you probably could just say for most healthy people, once you're kind of hitting around 60, we probably need to be probably a little slower, quite a bit slower with the protocol.
Yeah.
But for people who are living in a healthy way, younger than that, they can actually progress really quite well. And we see this with rotator cuff repairs when we do, isometrics at day 10, and we do, smart range of motion, partial range of motion, good control, good neuromuscular control from pretty much like week 2 all the way up to like week 6. And we start standing them and moving in different ways. And at week 12, they're ready for a strength training program. And that could happen for your typical, 52-year-old.
Oh yeah,
we see it all the time.
I think it's a great point. That's another thing, the ability to kind of progress not only as a whole, to say like, hey, can this person raise their arm, yes or no? But a good sports therapist will be able to create all of the progressions within that simple ask. Hey, can they raise their arm, yes or no? If they can't raise it safely or due to protocol or due to strength, there's ways that we can manipulate that environment in many, many variables, whether they're laying down or using a stick or using their other arm to support or using something on the wall to roll with. There's a variety of ways to do that. And having the ability to kind of dive into that process and picking the right vehicle, which tool you use, and then how long you ride it for. Let's do that for a couple of days, and then I want you to progress to this, a couple of days, then progress to that. You can escort someone through that at a much more rapid, effective manner, but it takes a tremendous amount of thinking, analysis, and then testing.
And that testing gives you feedback. And so I think the sports PT, there's no way we can do this by seeing a patient once a month. It's impossible. So when we say a sports PT, we're actually talking about a system that has intervention, a feedback loop, and progression based off that feedback. And if we have an appropriate rate of improvement for any patient that's trying really freaking hard, sports PT, like I said, anywhere on the continuum, you're interested in performing at your best as a human at that decade of life, and hopefully you have some fun goals. But as a sports PT, we are very curious about that rate of progression. We use the benchmarks as a loose protocol. It's a floating protocol that's slide left, slide right, based off of your DNA, history, and what you bring to the table. But that rate of progress tells us, are we doing well or are we not? If you're not progressing at a good rate, that's a concern. We then dive deeper into lifestyle factors. We dive deeper into aggravating factors. But really obsessing over the rate is kind of, I think, the big scoop here. And if you're seeing someone every 4 weeks, you don't have any clue of their rate of progress.
Yeah, no, you're right on. I think that's really it. It's not so much that sports or not sports, but it's that attention towards that rate of improvement and that focus on constant improvement. And even when you hit what you feel is like a good level or a stable level, can we even help you push past that if there's something else for you to achieve from a performance standpoint? That's a big part of the process.
Yeah, I think the disease patient is going to have a profile where that rate of progress doesn't apply anymore. If you're working in disease state, you don't even really care about you care about other things that affect the rate. It's not the PT intervention anymore.
Yes,
it's whether
I think
you're smoking.
I think that's where we get stuck in that model. Is that I think the PT is just too late to the party.
Too late.
Right? Like, and now can it Can it reinvigorate the party and get it started again? Like probably, depending on the person in front of you, But I mean, yes, I mean, if the person's overweight, if they've been less active, they're not eating well, if they're not sleeping well, and stress is a dominant force in their life, their healing is going to be significantly compromised, and you doing the right exercise is probably much of the wrong choice.
Yeah.
The right choice is, let's talk about getting that base of that lifestyle pyramid dialed back in. Let's start chipping away at some of those things. That's going to have a much more grand impact on that person's health long term. But I realize the patients don't always want that.
Yeah.
Those patients might just be like, I just want to be able to raise my arm again, bro. So it's like, okay, well, we'll work on that, but we're still missing the big picture here. And then our outcome will be very, very limited compared to what it could be.
Yeah.
But what the point here is that what demands excellence is that driven partner in the patient and the ability of the therapist to really focus on rate of improvement and rate of change. And that has been traditionally in the sports world, which is where this language came from. It's like sports medicine, sports PT, is that basically people think of it as faster. I don't know that it's faster as much as it's definitely more intentful. Like this is our intent, is we're going to get to the point we're going to do this, and we're going to try to do it by this date. We know these are all the rules, so we'll try to do this, but these are the steps we're going to take. And it's very, very engaging. Versus the other model tends to be like, well, we'll see it, let it come when it comes, and we'll see how the body handles it. And, we'll try this and we'll see what happens. And it's a difference in mindset and approach. So if you can use that typical sports medicine model that was first introduced and focused on the attention on improvement over very specific periods of time and the person being healthy and motivated, and you apply that model to multiple spectrums of people, I think you're going to be very, very successful. That's what people love.
I love that. It is a mindset. Sports PT is a mindset. When I first became a PT, I saw 1% sports, 99% general orthopedic, but I had the mindset. That's how I was going to run my patients, because I fully believed this is how we do it. This is what matters. And what happens is that 90% general outpatient orthopedic, they love that mindset and they start adopting. They start eating like you're encouraging them to eat. They start going to bed on time. They start going outside, going for walks in the arm sling. They start realizing all of these things actually contribute to their healing. They start creating a good habit right after trauma, right after the big thing that brought them to you. And you've now empowered them and say, this really does matter. You want to heal well and take your life back? I'll show you how. And that is the addiction that of why people come back, is because they're interested in the PT with that mindset. Now, it just so happens if you embody that through and through, what happens is a lot of athletes find their way to you because you're doing the right thing, and that mindset is contagious. And next thing you know, coaches fully believe in you, and you have the whole baseball team and volleyball team coming to you. You end up with more athletes. It is in here. So for all those PTs that listen and say, well, Russ, I don't really treat those people that you treat. F that. Yeah. The mindset's here, and then the world receives that information and says, I see you.
Yeah, I understand where you're coming from. This is something that happens all the time. I'll be teaching and I'll have a group of PTs in front of me, 20, 30 people anywhere in the country, whatever. And they'll be like, I can't do that because my system doesn't allow me to do it. And I'll always come back and be like, I acknowledge that like your system is broken, but it doesn't mean you can't think this way. And if you force yourself to think this way and look at things in this manner, like being very, very critical with a clear goal of where you're going with it, you can start breaking this stuff down and making little wins along the way.
Yeah.
And you can do this in any environment. Is it harder in a broken system? Yes. Do you find yourself more challenged and burnt out? Yes. Does that lead you to then getting lazy and then just doing average PT like what we've seen in the population over the last 40 years? Yes. And that's a problem with physical therapy in general, is it's very hard to maintain this level of focus and effort and attention to detail with people who don't care.
Yep.
So we acknowledge that fully. However, you can help your people care more when they meet you and be inspired by your knowledge and the way you communicate with them.
Yep.
And that's what we've been doing for years. That is the biggest common ground that we have and that we take as individual people between Russ and myself and many, many other of our colleagues at KIME. Is the common ground is that we care a ridiculous amount, and we're willing to work extremely hard for our people, be very, very detailed, very, very thorough in our thought process. And as a result of that, we've created a system that allows our therapist to do that. Because if you don't have that, then I think you can't do this model successfully. Can you do it? Yes, but you eventually will find it being very, very challenged.
Yeah, that's it. I mean, it sounds a bit. I mean, maybe it sounds overly passionate or altruistic or a zealot. But I believe in this world where the PT can live the experience that they want, the principles that they embody, and then the patients come and do the work, and they're empowered, and people heal, and they get better, and they transform. I think the PT transforms through this process because they realize they don't have to be burnt out by a career. They can apply their brain 100%, and the patients realize that they can take their life and get a hold of it and start at the foundational lifestyle level and make a difference.
Yeah.
And we can do this. This is what health should look like. I mean, when you look at the whole political craziness going on right now, it's a big hot topic of, the health of children in the United States and the obesity epidemic and how much diabetes there is out there. It starts with us. I think we are the most critical part of the entire US health system that teaches these principles of how to live a better life. It's well past rotator cuff injury.
Oh yeah, I think that people respond well to it, and people start to hear that I have diabetes, and well, we're gonna have to take it slow with you because you have diabetes, and you're not gonna heal as fast as someone who doesn't. I think that's
powerful.
Most people are at that point be like, oh wow, this matters.
I didn't realize it affected my shoulder.
Yeah, I just thought someone labeled me with this and I have a difficult time processing sugar. No, this is actually a big deal, and many times it's self-caused, and several times it's not. But if it is, then all of a sudden damn, I gotta get some things going. You can really, really be inspirational, which I think is tremendous. That's the thing. If you don't come at this with some passion and some energy, it's gonna be tough for you to be successful, because it's freaking hard to be in this country, for sure, in the United States, and eat healthy and live healthy and do all the healthy things.
I go to the grocery store and I'm just appalled. I want to just give a public announcement. Public announcement, everyone. Just want to tell you what's known by all systems that food you're eating is probably not the best. But I look at every eval that comes onto my schedule. I really want to ask that person, hey, you ready to change your own life today or what? Yeah. Because if not, we can rethink that and come back tomorrow.
You do that actually, Russ. That actually does happen. That wasn't a philosophical thing. It's kind of like, all right, what's up? And they're like, oh yeah, I don't eat this. He's like, well, we're going to start right now.
Yeah.
You're going to have broccoli tonight. No, that's it. I think it's so hard in this country to do the four basic things we say. Move a little bit, sleep, 7 hours plus. If you're a kid, 9 hours plus. Eat well is the general concept. And then manage your stress.
Yeah.
And those things sound they sound like simple words.
Yeah.
But when you start looking at your day-to-day functions, that shit's hard to do.
You're 3% of the population right there. If you can do those four things moderately well, you're probably a 3%er. And there's no reason why that can't be a lot more. I think everyone who's listening right now, if you embody this, if you're a PT listening and you embody this spirit, then can you please share that to the world?
That's all there is to it. You just have to chip away at these things. And it's funny because you'll get resistance. I mean, we talk to patients all the time and say, hey, man, I'm only getting 5 hours of sleep. I've only getting 5 hours of sleep my whole life. That's how I operate. You're like, all right. But right then you have to then put it in a framework to say okay, well, that's one of the 4 boxes. So we're already 1 down. If you're going to give me a nutrition box that's also down, now I've got 2 out of the 4 down. What I've noticed in my career is that you are now working against your favor. The odds are now stacked against you. 2 out of the 4 boxes not in line, we've got problems. You can get away with a lot with 1 box out of line. I don't know, the 3% of it perfect. I bet 70-80% could have, or probably at least 50% could have 3 boxes. Having 4 is really, really hard. But if you're down to 2, then you're in trouble. And I think the disease-based group is probably down to 1 box, if any. Yep. It's in trouble.
I mean, if you're a young person, you got to get to work because you have your body for life. But if you're a parent, I'll tell you, it's a little secret to parents is the kids don't care at all about what you say. It's about what you do. So if you want to instill the right principles with your kids, you have to live those things. They watch what you do, and that's how they learn. They learn squat from your words. It's all your action. And so I think that habit research and the psychology of it all is fascinating. And I feel like every PT or person in sports med, hopefully you've dove deep into human psychology and what motivates and the passion and drivers, and then the fears and the issues that people desperately trying to steer away from. You have to understand that to move the needle.
Yeah, I fully agree. So we differentiate this quite a bit in our platform. When we have someone apply to work for our team, we're actually looking at their experience as a common. Everybody looks at what your experience is. Like, how many years have you been a PT is the common thing. We actually don't care about that because, unfortunately, because of this trend in our industry, you working for 10 years or 20 years in a system or in an environment where you weren't forced to think or work at a high level, which we would call a sports medicine level or a high performance level, you're probably haven't improved all that much in a period of time.
Yeah.
So for us,
maybe even gotten worse. Maybe.
Yeah. You've probably gotten negative for sure. So, I mean, to be, whether you're 8 years out or 10 years out or 15 years out or 20 years out, there's less of a factor to us than how experienced are you in working in this environment of coaching people. Because if you're actually coaching people, which we would consider to be sports medicine or high performance, or even if you were coaching like a swim team, like I don't care.
Yeah.
But you were coaching someone towards a goal, and there was an expectation that you were going to improve that person's ability to accomplish that goal.
And a feedback.
Loop that required you to then modify your programming and either, ramp it up, ramp it down, whatever, but do something as part of that process.
And someone shows up 2 days later, teach me again because I didn't get the lesson.
Yeah.
When you have anyone that interacts with that degree of chaos, because we're going to pretend there's a lot of rules in this, but really it's a very chaotic environment to coach a team, to be a trainer in a gym, to operate a class in some kind of, fitness studio. Like, these are all realms of chaos, and managing that chaos is a really amazing thing because you get exposed to so much in a hurry of the litany of human issues that all come and try and get better at one moment.
Right. So when we look at someone with this experience, we score them not only based on not so much years of experience, but years of sports medicine experience. So we basically look at his coaching and your level of commitment. And you could be a sports physical therapist, and that gives you a lot of credit, assuming you were actually treating sports people. But to just say you're doing sports and then be in a disease medicine population where you weren't attracting athletes to you or working aggressively with athletes tells me that your mindset wasn't in such a place. Because if your mindset's in the right place, you're not going to be able to stay away from athletes because they will find you and be like, I want someone who's thinking. I want someone who's critical. I want someone who's working towards my goals in a very specific way. And then if you just showcase that as part of the way you communicate, the way that you practice, your clinic will be filled with those types of people, which is what we see every day. Mostly because that's what we've been doing for years, except nothing less.
Yeah, it works. There's really no excuses. I know a lot of people can have the excuse of the model that they're within, and that's definitely, like you said, those are barriers. There's hurdles and obstacles, but it's not as much of an excuse as you might think. I worked in an HMO, purely hospital grade outpatient clinic with the drapes and the private rooms. I used to use a broom for a deadlift. It was great. It was really kind of fun. And I ran in the parking lot. I had to make sure no car was coming. All right, let's do some form running. It was really kind of crazy. But really within 3 or 4 months,
figured it out.
I was with the whole PTs that had been there for like a lifetime. And they were all really wonderful PTs, but none of them spoke the language I spoke. I was there for 3 months, and I was already treating the CEO of the whole entire hospital. Because the CEO of the hospital was an avid cyclist. And once he had an injury, he knew where to go because I knew how to get him back to elite level cycling. And then within a matter of months, I was treating all of the nurses that were in the CrossFit class. So I quickly became like, oh, if you're an athlete, go and see Russ. And it was unfortunate the other PTs didn't speak this language because the other PTs were actually really healthy. They were some of them were cyclists, some of them were yogis, some of them really did fitness, but they couldn't speak of the passion that they loved.
So what was this is the difference back to the mindset. What did they say to you at the end of work? Now it's time to go.
I don't know.
You said they would leave the office and say, now I have to go do my...
Oh, I'd have to go do my real job. Yeah,
yes.
Yeah. So, they were all parents. And they would oftentimes like, okay, I got to treat my patients for 8 hours. Now I got to go home to the real job.
Yeah.
And the real job is, helping your own family.
Run the family.
Family.
Which is a massive job. Not to say it's not. But the mindset is that I'm here on autopilot running my day,
Yes.
which is the norm in our field, unfortunately. And then I have to go home and turn it on and then deal with that chaos. We just do chaos end to end.
Yeah, that's right.
From start
goes
to
the whole way.
Yeah, you just do it the whole day, and then you'll be much happier. You actually see the patients you want.
Yeah, whenever someone says they can't sleep really well, like, oh, you just have to be in chaos from 6 a.m. to 10 p.m. Then you have no choice. Your body will shut down.
Yeah, that will work out. I think there's probably something to that. If you don't challenge yourself enough, you probably don't get tired enough to need to rest.
Yeah, to need. Yeah.
There's another side of the coin there. You can do too much as well, but
for sure.
Nonetheless, I think that statement says a lot. And it's the idea of mindset, and that's how I would differentiate this field. We in our own internal structure, we look at this as sports medicine versus disease state medicine, and that may be a new term to think about if you're in this field and you're listening. And if you're a patient, this is what to look for. Are you walking? And you know what it feels like immediately. We hear it every day. People walk into our clinic versus they walk into another clinic that they've been to at a different company, and they're like, oh my gosh, it's just a different energy and a different space, a different environment. Most of that energy is brought upon by our staff and our people because they have this energy of focus and excellence,
yes,
and problem solving, where they really want to do this and they have a vehicle to do it. So that's what it should be. That's what I think what the profession should feel like. That's what we say. That's what we mean when we say sports medicine.
It's a mindset.
Yeah, it's a mindset, and it can be applied to really any population, any group. And regardless of the group you have, my encouragement would be like, don't give up with that group. You'd be amazed what you can change, and the people that you attract. We have a patient right now, just to go full circle, that can't move, totally wheelchair bound, moves his automatic wheelchair with just the movement of his fingers, and he's nonverbal. And he literally has to be picked up and transferred to the table, and he still comes in. He's been coming in for like better part of 8 months, doing what you would consider to be traditional PT work, flexibility work, neurological tone management, these things. The PT who does it still approaches it with a strategic mindset, critical thinking. How do I take this today and build on this to tomorrow to make some improvements, make some adjustments, And if nothing else in the young man's life, you can see like the joy within him of how much he enjoys coming, because it's one of the only moments in his whole life that he gets that kind of coaching type of feedback.
Completely.
Where his family has certainly not given up on him, but you can imagine that most people look at him like, ooh, it's too far gone. I can't help this person.
Right.
So you can apply this in so many levels, but and I know we all started with it when you got your degree. That's what you wanted to do. The matter of just gotta stick to it and go after and keep up with it would be my encouragement.
Completely. Yeah, sometimes I paint it a little bit overly simple just for my brain to understand. But even if I sometimes will have like quite a few work comp cases on my schedule, and oftentimes I'll give a work comp patient maybe one exercise, and I want them to do it every single day. And if they come back that next time and say, hey, how'd the exercise go? Like, oh, great. I did it last 7 days in a row. I did it 3 sets, boom, boom, boom. It's actually feeling a lot better. I, in my mind, think, here we go. Let's do this. And if they say like, I really couldn't find the time for it, then I realize, we have a mindset problem. And then we're going to have a mindset intervention. Yeah. So to me, the work comp turned sports med as soon as they said, Russ, I'm committed. Yes. And when they didn't follow through, like, oh, we have a compliance issue. Okay, I shift. We're not sports yet. Like, you have a brain problem, and let's attack the brain problem. And if we're going to win or lose based off of that. And if we lose and it's just the wrong time of that person's life to make a change, then so be it.
Right, that's okay.
That's okay.
Then you should advise them, that's the right thing, and then discharge them.
Yeah.
So they don't further burn you out or such. But if you feel like you can continue to change their mindset and you can improve it, and they're committed to at least being part of the process, then that's fine. You have to make an active decision on that.
Yeah.
But yeah, I agree with you 100%. That's the idea is, could they give you something to move in the direction that we're trying to move into? And if it's one exercise, or if it's even partial of one exercise, like, hey, at least you gave it a shot. Now we can have a conversation about it.
I think what's fun, going back to like the workers' comp thing, is finding other hobbies that they're interested in. Let's find some alignment. I know you're trying to get back to your job, but also you're trying to get back. I had one guy, he had a disc. He was a heavy equipment operator, and he had a disc replacement, and he loved doing boxing. And so we'd always talk about how to stabilize the neck so that he kind of hit like a 1-2 punch. Even though I knew he had to get back to heavy operating work, I just aligned it with something. We're aligning to work. I get it. We're also aligning to your life. Let's not try and overthink things. Let's just kind of simple. Let's have a goal that's personal. Let's have a goal that's professional. By the way, I can combine them. and then it became sports
100%.
PT in a work comp environment. So I don't want people to kind of think of fun little excuses like, well, that payer doesn't pay for sports PT. Any of that BS.
Yeah, no. Sport is not the important part of the aspect. It's your mindset and the way that you approach it strategically and consistently. And it could be very, very small, like very small activities, small movements, or it could be very large ones. It's just that sports demand you to think this way, which is why it's kind of been filtered that way. That's why everybody says they want to be in sports medicine. Oh, I want to do sports medicine. That's great. The other side of this coin is that on your end, as a clinician, it's a hell of a commitment. Mm-hmm. Because the second that they walk in and you don't have the solution or answers, it's immediately your responsibility to get it. And if you don't, then one more visit. And if you don't have it the second time, they're gone. Yep. They're going to go find someone else who does. And that's the side of the agreement that you take in on this, is that you are also really bettering yourself consistently so that you can do this at the level that's being demanded of you. And that's, once again, what we all signed up for. Whether or not you really want to do it in life, I think is a reasonable problem to have. It's a reasonable consideration. Life has many challenges, but that's at the end of the day, these are the differentiating findings.
And it's a sharp sword. I think you got to be ready for little micro failures, to really learn. And there's no way you're going to become elite in this space without having a few failures. A few people that thought they were going to pick you and pick someone else and slapped you in the face because of it.
Yeah.
You have to have that occasionally, or else you don't really actually have the right feedback. It's happening. Just most people are unaware that it's happening. And if you're aware of it's happening, it should drive you to be better faster. Let's not wait for 10 years experience. How can I get good now?
Yeah. Most people aren't going to tell you did a bad job today, so I'm not going to come back tomorrow. They just don't show up again, right? Well, I was talking to a surgeon one time, and this was astonishing to me. He's, and this happens, I think this is a lot in like their personal literature and research. I think you have to be very, very careful with this, but the assumption was the patient didn't come back, so they got better. And it's like, whoa, like that's probably not the case. That could be the case. That could be the case. But in that regard, you're probably going to get a thank you card, or they might come back and just say thank you and I'm amazing how great I am. It's hard for someone to get amazingly great in 6 months after surgery period. So you may not see them all the way to the end, but usually they'll come back for part of that process. But if you met with them, gave them some advice, they didn't come back, that's not necessarily because you were amazing and fixed it in one visit. Most likely they went off and found additional help and found help from someone else. So
I mean, not specific to PT, but any professional in my life that I've asked for someone's help and I've only seen them maybe once and they changed my life, I will always steer other people to them and say, you make sure to tell them I say hi.
Yeah, for sure.
Every single professional.
Yeah.
So the only time you're walking on water by doing like a one-hit wonder, like first pitch, grand slam, if you think you're doing those, then you will hear about it.
Yeah.
You would know.
Yeah. Yeah. So keep that in mind. The feedback loop sometimes is not as complete as you would hope. And that's feedback in itself. If your loop doesn't go full circle, then you're losing something somewhere, and that's something to pay attention to.
That's how we get better.
Yeah. Against the mindset of excellence. All right, thank you guys. Thanks for listening. Jump in on the conversation and please contribute via the social media channels, comment in the comments down below. We'd love to interact with you guys that way. Thanks for your time listening, watching. Get you on the next one.